And thank you for all organizers for this opportunity to speak to a group about some of our learnings and some of the activities that are going on within policy-wise to help support really what we're talking about today, about generating better evidence and helping organizations use that evidence and connect on that evidence to really improve care for clients and in this case, youth. So again, my role is mostly around operations for our data-related initiatives, but I do get the sort of the privilege of really sort of realizing and implementing some of the strategic visions for the organizations as it comes to data. So policy-wise, I don't know how much Robin might have talked about in the past about policy-wise, but I'll just cover it fairly quickly here. So we've been around for about 15 years. We are a little bit less than 30 people, I think, right now. We basically exist to improve the lives of children and families through helping organizations like governments and nonprofits to generate and mobilize knowledge, okay? And so my part is more about data, but we do have lots of staff and capabilities around evaluation, for example, for some of our staff here today, as well as we do one off and on provide some research grants as well, some small research grants to again help the research community align their work with what is needed in terms of knowledge and information within the social sectors. So here's our impact statement. Again, we are very much focused in on that evidence generation, evidence mobilization around data, and really our data capabilities are one of the unique parts of policy-wise that I'd like to talk a little bit more about today. So it's interesting, from the talk from Stacey this morning, it talked about a lot of evaluation, a lot of collection of that evaluation type data. And so our main niche in this data analytic space is really around a secondary use of data. So that really means the use of data that is pre-existing, often really collected for some other primary purpose. So for example, data that might be collected to pay physicians. That's the primary purpose. We're co-opting that for either research or evaluation type purposes. So that's what we mean by secondary data use, and they're very complementary approaches, right? So sometimes you really do need to collect data in a primary manner through surveys, through research work, but you can usually only reach hundreds, thousands, tens of thousands type of scale. Whereas administrative data, you can't often answer exactly the question that you would like to ask, right? Because it's with data that's collected for some other purpose to begin with, but then you're reaching millions. So again, secondary data use also comes with other benefits, such as just really using the data that's already there. It's much more efficient way of gathering intelligence, and it really limits the burden on people in general that you may be engaging with in asking for answers. So it's a matter of really extracting more value out of data that you're already collecting through your funding anyways. The other thing is, of course, through large data sets that might be administrative in nature, it opens up a lot of doors in terms of advanced analytics as well as advanced techniques such as data linkage to actually look at populations and individuals across different sectors. And I think that's one of the messages I'd like to kind of bring across today is really, we're of course gathered here because of mentoring and all the value that it provides for society. But there's of course that client-centric view that of course each individual client that is being mentored may have other needs as well across other sectors, and it's important to also keep that in mind and create collaborations where appropriate. I'd like to talk about a couple of the main data-related initiatives at policy-wise. So first of all is the Child and Youth Data Lab. So this is something that's been going on for about 10 years now, and it's a fairly unique, groundbreaking initiative in collaboration with some of the government ministries, and I'll have the government ministries on the slide here next. But basically it links and analyzes government administrative data, and they're across the ministries that work with children and youth and families. And it is very much targeted at that government policy maker, executive leadership type of audience. So we meet with them all the time, weekly, monthly, sometimes daily when there's something going on, to really seek out what is that information you need now? What is that gap that you have that we can help address with your data? And again, it has that focus on children and families. I'll spend a little bit more time on SAGE, which is for us, secondary analysis generate evidence. And this is more of a data collaborative platform. So where, I'll talk a little bit about CYDL, but SAGE is meant to be that platform for everybody. So not really just for the government, not targeted at the government, but for all the other organizations that may be at the table, and eventually really helping them collaborate with governments as well. So here are the ministries that are involved in the Child and Youth Data Lab, so Children's Services, Community and Social Services, Education, Advanced Education, Justice, and Solicitor General, and Alberta Health. And so we have data for a population of youth, so basically from the age of 0 to 30, and across the years of, I think, 2005 to 2011. So it's not like completely up-to-date data, but it is 6 years worth of data on over 2 million people in Alberta. So it's an incredibly rich resource for looking at how populations journey through government programs and how they receive support, and in some cases, some inkling of outcome as well. So again, please, yes?
So can researchers and program directors within those different organizations access your databases?
Yeah, so that's part of the discussion here. So this data, again, it was basically contemplated, all the agreements and whatnot were created 10 years ago now, 9 or 10 years ago now. And the data is a giant linked data set that resides with us at PolicyWise in a very secure facility where we have to, like, not quite a retinal scan of files and people like that, you know. But it is a fairly secure type of data set, and it's so secure, and they were so sensitive, our partners were so sensitive at the time that we can't actually give this data back to government. Okay, so it stays with us and forever, and it'll be destroyed with us, and it'll die with us, basically. But what we do is, then, again, why we work with the government all the time, why we meet with them all the time, is to look at what do you need for information? What can we analyze and crunch and answer for you with this data? Because that's really the only way that they can get to that. So we are looking at different ways of working with this data. So we are looking at other different types of partnerships within government as well as outside of government. So this is one thing that is something to keep in mind in terms of contact with us. You know, so I invite anybody to come talk to us in terms of learning more, exploring possibilities. But again, there's no direct access to this data, but there's potential for exploring what questions you might want answered. And the thing is, you know, if you ever looked at it, you may regret wanting to look at it because really it's a gigantic data set. So now, and that fact in itself is actually one of the reasons why we created SAGE, to be that more open platform. So 9, 10 years ago, we entertained the idea of making CYDL a more open platform. It just didn't have the appetite or the impetus at the time to do so, and very understandably so. This is really quite new. So around the world, there are other population data linkage centers, and in fact, there's a global, there's an international conference in September this year in Banff. So I invite you to all attend. But very few of them actually integrate social data. It's very much based on health data in these other centers around the world. So this is still fairly unique. So I wasn't planning on really going over this too much, but I will bring it up just as one of our sort of key deliverables, just because, again, it was brought up a little bit earlier before with regards to, say, interaction with justice. So we have this program overlap matrix. This is on our website, publicly accessible. None of this is sensitive in terms of a privacy aspect. It's all aggregate data. But up on the top and sides, these are the key programs that we have within our data set across those government ministries. Okay, and some of them aren't programs, some of them are more aggregate indicators, but suffice to say, these are the separate areas for which we have data for. And I saw a couple people taking pictures. Don't worry, the slides can be shared afterwards. You probably don't have to take pictures. So for example, you are able to then look at different aspects of corrections and, say, post-secondary interactions, right? So this matrix is actually a fairly simple representation of just pure overlaps between different government programs. Really just purely who's walking through the door. we have lots more data, and we have lots more other data products that talk more about those details, but this is that first one. The best thing to start with if you want to come visit our website and orient yourself to really what types of data that we have, and some of the insights that we can even gain just with this, because this in itself is really quite novel to the government of Alberta, right? So quantitatively, or anecdotally, they've always known certain interactions between different programs in terms of client overlap. But this is one of the only ways that they can do this quantitatively and empirically and looking at their own data because of their, there's a lot of concerns around privacy, around the fact that, just the government ministries are technically legally separate entities. And so sharing data amongst themselves is not really just a very simple one government type of issue for them. So this is that way of looking at the cross-ministry, cross-sector aspects of how populations fare within the social systems that the government provides. So I won't really go into this. I would definitely invite you, again, we'll have an email at the end and my email at the front, and of course through Robin as well. Please do get in touch if you'd like to learn more about this. So this is just, again, a quick example. I'm not going to really dwell on CYDL today, but this is just some of the other products that we have that are specific programs within the ministry. So, this one for FSC, this one for income support, and some of the characteristics, over time as well. So again, the power of the longitudinal data set.
And this is the SAGE database?
No, this is the CYDL. Although really, I don't worry about too much about what's CYDL, what's SAGE. So we are policy-wise. So please, come visit us and have a look at what's on our website for resources, and we can certainly, again, talk to you, interact with you, and see what questions that we could answer. And one of the things that we've been thinking about is there a broader question that can be brought up in a grassroots manner from the community, either from a sector such as mentorship or some other way that we could really work with government, because an issue that's important to you really should be an issue that's important to the government as well. And so they're very interested in hearing about that and hearing about how we can help everybody. So, but again, speaking to the access of that data, so again, that data is very, very locked up, right? It's within our secured environment. It's, we have to do police checks and all that stuff. So one of the things that we wanted to do was, looking forward, this wasn't really the best, most ideal way in terms of looking at information, data, and evidence, right? We want to be able to share. We want to be able to collaborate. We want to be able to sit around and poke it and see what we can come up with. So what we decided to create a few years ago, about 3 years ago now, with the generous support from an anonymous donor that partially supported the first phase of this, is called SAGE. And this is built as a data collaborative platform. So at the base of it is a repository, is the technical infrastructure to store and manage data. But for us, it's really much more than just a storage place for data. It's really a conduit for people to connect. So first, we've been working with a lot of researchers in the last few years, really espousing the value of reusing data, really leveraging their data again and again to answer new questions. So we have some data, research data sets in SAGE. For the last year and a half or 2 years, which is mostly the focus today, is we've been also working with a lot of community organizations, again, talking to them about the value of their data, about collection, use, and sharing of that data, and what they can do together with it. The third piece is we've also started some discussions with the government in terms of moving forward in this space. How do we work with government data in a more accessible way? I mean, not open data. So one of the key aspects for SAGE is that it is not open data. It is data that is facilitated access through proper governance, depending on what the producer or owner or ultimate steward of that data needs to do to protect people's interests. So what we're really trying to leverage is all the things that we've learned in the last 10, 15 years about how to collaborate through data. Okay? And some of that has to do with say, privacy, data privacy. So again, we work with governments. We do work with fairly sensitive data within those government ministries. we do not get names. So it's difficult but not impossible if you really want to identify people. But so again, there are many privacy aspects to consider. Governance in terms of really looking at what are the rules and what are the gates to looking at that data and how we look at that data, what types of analytics do we conduct on it, and ultimately what do we release and share, and who do we release and share to, so that it's a relevant piece of information, and minimizing misinterpretation where it's possible. So again, there are other aspects such as legal, ethical aspects in terms of how we look at that data and how, again, all with the view of the fact that the ultimate owner of any data that you collect, any data that we collect, any data that the government collects, is the people themselves from which it was collected, right? And that is the intent of the legislation in terms of privacy legislation. And we want to make sure that that is well protected and well adhered to.
Jason, do you want to mention too that we are working with the Alberta First Nations Information Governance Center
Yeah.
and
So,
ensuring that we're in compliance with the OCAP principles as
yeah,
well?
yeah, absolutely, absolutely. So you'll notice, in both that matrix and if you were to come to our website, you'll notice a bit of a dearth of data on Indigenous populations. And part of the reason is we're taking that extra time, again, to work with AFN and NGC and learn how we develop those relationships more appropriately and more and answer more relevant questions for those communities. So again, it's a slow process. It's a big piece of learning for us as individuals and organizations. But again, it's worth the time, and so that's why you often don't see it as much as you may have expected. But within the data, we do have some Indigenous indicators, and that is actually one of the interesting learnings from the CYPL and now that we're working with nonprofits as well is the part about sort of how this type of data might be collected, right? So this, Indigenous is such a big word that captures so many different concepts. But throughout the last, 10, 20 decades of data collection from government, it hasn't always been collected well or the same, right? So some may ask in a form of an intake process, what is your treaty status? Some may ask, do you live on this reserve? Some may ask, band number and stuff like that. So again, it's very difficult to reconcile some of that data. And one of the pieces that we're looking forward to is working with government again to improve that data collection, again with the AFN and GC of course, but also with the nonprofit sector in terms of how, are there guidance around collection of that data or even gender identity, which wasn't even contemplated 5 years ago, right? So. Now, I'd like to get a little bit into some of a survey that we ran recently, and I'm hoping some of you in the room was actually participants on this survey. I'm going to present it. The couple next sections of my presentation are out of temporal order. So we actually did this survey last couple months, and then some of the work that I'll talk about that we did in Calgary was actually done in the last 18 months. But it just makes more sense this way. So what we decided to do, okay, so as for my team anyways, a lot of our background was more in, say, government, like Robin said, I used to be with health, or some kind of research background, and myself and most of the team within sort of the data initiatives part, we haven't had a lot of experience within the social sectors in terms of the nonprofit organizations, other than policy-wise, of course. And so, and more broadly, there was really a gap in knowledge in terms of really within the sector. There's such a variety of organizations with different funding sources, different mandates. We wanted to get a source, get a sense, and validate some of the anecdotal evidence that we were hearing about how data was being dealt with and used and shared in the nonprofit sector. So we went out with a survey. It's technically still up, although it technically passes the time. But I'll just present on the first couple months worth of data collection from we had about 107 respondents, and we did ask that each respondent be representing their organization. So we do believe that it's close to about 100 organizations rather than 20 organizations from one of them or something. So this is just as a basic slide, a spread in terms of the organization and the type of organizations that have responded. Just note that this is not mutually exclusive categories, so they were allowed to choose as you know, as many of your organizations can attest to, you do more than just mentoring, right? You do take that client-centered approach in terms of how do you help these people. So of course, then there's more than one category of them. But most of them are in social services, which is well aligned with policy-wise as interest and who we've been trying to reach out to thus far. So one of the first questions we asked was around their current data management practices, right? So, you know, so this is some of the responses, and it's very heartening to see that, for example, many of them do see data as an asset. It is aligned with organizational goals. It is regularly improved. But you can also see that it's rarely, I'm just grabbing my notes. It is rarely standardized. And you know, and it is you know, sometimes informal and ad hoc as well. So this is just kind of baseline data on where they're at. Types of data collected, probably no big surprises here. Most of it is program data, so you know how people you know what people get within their programs, for example. It is nice to see that quite a few of them do collect some sort of outcome data, so it would be interesting to dig into that a little bit more to see what that really means. So we asked them about what their organization's data sharing attitude was, and it's great to see, you know, a third of them, they do share data, right? So it is very positive sign in terms of this shift in terms of culture towards a more open stance and more transparent stance. We do have quite a few, of course, that do not share data at the moment, and then of course some that don't know it somewhere in between. Now, one of the key flaws, unfortunately, that we do have in the survey is what we really should have done was really define exactly what shared data means. Because I do get the feeling that a lot of this we share data is in the terms of aggregate data, in terms of their reporting back to their funders and to the annual report, that type of sharing. And so we do have that concern, so we'll need to clarify that a little bit either the next round or through more one-on-one contact with some of the organizations. But again, I mean, it is a good sign at least to see that organizations are moving in that direction. So for the ones that don't, we ask, why not? So why aren't you interested in? And so again, it's interesting to see that the top one is really around the privacy concerns. And then, and another one related is, cannot legally be shared. Okay. And so I'd like to talk to you about that a little bit more because I think there's a lot, first of all, some of this, I think we hear a lot when we start engaging with the nonprofit sector, right? That they can't or that they have privacy concerns. And I think, one of the key pieces is to really clarify what the concerns are and what they mean, what does it mean to sort of hold that obligation with your clients, right? What does it mean in terms of their expectations, like your clients' expectations in terms of how they use their data? And I think sometimes it's also just uncertainty around their understanding, right? Because many of the organizations that we do, we have been talking to, I mean, they don't really even have a lawyer. Actually, we don't have a lawyer either. I mean, we rely on our interaction with the Office of the Information Privacy Commissioner and the government of Alberta for that kind of advice. But again, it is a difficult space. It is a scary space to go into if you haven't had those conversations, if you haven't had that kind of discovery within your organization, and it is that safer position to just say, no, really can't. So now, some of the other ones, technical capacity, resources, and time, right? Those are also important in terms of what we've seen in the organizations that we've worked with. A lot of capacity needs to be built, and that's one of our key focus areas for the next several years. But again, I think many around the table today can probably understand that, right? It's not like you're overflowing with funding, right? You're busy, recruiting mentors. You're busy providing services, and answering a request to share, tons of data is not really top of the list for you to do this. So we understand that. Some of the more generalized major challenges for their organizations in terms of just data and how they see it. And again, a lot of this is around people, right? So for example, staff need more training. This is pretty much the top one here, right? And databases are not user friendly, right? So again, more of that training people with usability issue. And then we have this set over here that are more about technical issues, right? So not consistently formatted or that not even entered electronically sometimes. And so again, those represent challenges that again must be considered in terms of how policy-wise or other organizations might be looking at collaborations based on data and evaluation as well. We collected some qualitative comments as well. I know the red doesn't show up well, but I won't go over all of them. But there are definitely different perspectives. So it's interesting. For example, that some are saying the outcome data is either not collected or not linked to specific individuals. Like they might be anonymized surveys. They might be very broad, loose feedback within a box, that type of thing. Some are talking about demographic information. Some talk about other measurements, harmonization type activities. So I think what we see in the sector is there's definitely strengths, there's definitely weaknesses across different organizations, and I think there's a great potential really for organizations to work across each other and really kind of patch up each other's weaknesses and draw on each other's strengths. So I'll just end the survey with this in terms of, if you were to share data, what would be your draw? What would be your motivation to share data? And then again, very glad to see that collaboration with other nonprofits is really top of the list there. And so we really do see that desire, at least, to work with other nonprofit partners, collaborate on their data, and sort of be more cohesive as a general sector. So that's it for the survey. And so now I'd like to get into some of the work that we've been doing for the last 18 months in Calgary in addressing some of those issues. And again, this is temporarily out of order. So again, we had heard a lot of those issues, a few years back when we started engaging with the nonprofit sector. So the survey was more of a quantitative confirmation of some of those anecdotal comments. But in response to some of that, again, within policy-wise, it's so core to our DNA to look at evaluation, look at how we generate evidence, look at data and analytics, that this really seemed like a good fit for us in terms of moving forward with a data collaborative platform to help organizations work together on their data and generate the evidence that can feed into their processes. So again, about a year and a half ago, we applied for a grant with the Calgary Foundation, and we were successful at a grant that would be working with these 6 organizations on the board here. And so that's the Calgary Food Bank. CUPS is the Calgary Urban Project Society, which is an organization that provides health and educational resources and services to the community. Sunrise Community Link and Southwest Community Resource Center are both sort of community resource centers for various linkages and services. Calgary Counseling Center, that's very self-explanatory as well. And I think Families Matter, I know them a little bit less, but it's fairly similar in terms of that navigation, that connector role in terms of helping, again, families and community get the services that they need. What we wanted to do was really get together with these organizations and look at what are some of the barriers that you faced in the past in terms of data sharing and collaboration based on data that you've had in the past. So just so you're aware of some history here with this group. So Calgary Thrives was a larger group of 22 or so organizations that had gotten together maybe a few years ago, and with the purpose of looking at how they can share data with each other. And so they got through a lot of discussion, a lot of discovery, but didn't end up sharing any data at that point. And this is more of a follow-up. So of that larger group, these are the coalition of the willing. These are the people that are more ready to have that conversation and take that next step. And so that's the ones that we kind of grabbed and said, yeah, let's do that right now before you change your mind. we wanted to look at some of the barriers that they were facing, and some of them were legal and ethical and privacy in nature. Some of the technical barriers as well, right, in terms of what we outlined in the survey, such as data not collected well, data not organized well, not managed well, and whatnot. And again, being policy-wise and having our sort of eye on more advanced analytics and data management techniques, we wanted to really look at whether or not some of this data can be pulled together to formulate perhaps a slightly novel poverty indicator. Don't get your hopes up. It doesn't go too far in that way because the data wasn't great, but I'll get to that in a minute. But the other big thing, the other really significant learning from this was that we were able to conduct a proof of concept linkage between some of these organizations, which I'll get into a little bit later on. Again, it's a fairly novel way of looking at that collaboration piece. So the biggest thing for us was really building trust with these organizations. Again, many of them are very resource-strapped, and this is not their main focus. There is, I was at a training course yesterday, and one of the people, and it was full of sort of nonprofit participants, and one of the elephants in the room is always the competition, right? So everybody, when they talk, they'll say, oh, of course we don't compete, we're working on, together and stuff like that. But inevitably, like when we have funders, at the table with limited funding and more impact to the community than we can necessarily do with that resource, then of course there's going to be some aspect of competition. And so again, building trust was really important to this project, and really with any kind of collaboration. So again, we looked at the types of data that they collect. So client information, some outcomes, programs type information. And of course, some of it is collected for funder purposes. Some of it really is to modify services and for resourcing and for operational purposes, as expected. Now, some of the data is collected through a consented process, so some not. And again, I think this is something that I think many around the room today can understand. In the case of food bank as an example, you can't really say, sign this and then we'll give you food, right? So it's a slightly coercive in nature. So there are different aspects of how consent can be done and what really should be informed, right? So it's not. So there's a gradation and continuum between not telling anybody anything and asking them about every single formula you will apply to their aggregate data and whatnot, right? So there is some middle ground to that. So make sure that people do understand what is collected and how that information will be used and how that will impact them. So we did again work with some of the organizations. It's a bit of a work in progress, but we do have a bit of a template for the nonprofits sector to at least consider. And again, this is definitely one piece where I would love to get input from the audience today and go to our website. It's posted on our website because again, we've only seen maybe 8 examples of this type of document, right? And we would really like more input on what works on the ground, right? Because of course, from my past, dealing with say clinical trials, you're dealing with 30-page consents, that has like all these bleeding gums and all these other adverse events that can happen to you. But here in this context, it's like half a page. Get your point across, and sometimes people don't have the level of literacy to necessarily understand all that. So do you go to a video or an audio type format? But again, we would love to get more input on that. Now, again, I mentioned one of the key aspects for uncertainty in people's minds as a barrier is around their legal status, their legal boundaries as organizations, what they can and cannot do, right? And so so there's a postdoc, her name's Kieran. She's actually used to be a lawyer as well, so it works out great. And one of her key research areas is actually participant attitudes towards data sharing in the research sphere, right? In terms of kids and parents and whatnot. And so she worked on this legal analysis. It's fairly long, so there is a shorter version once you click this link for a summary. But it really then talks about what are the applicable pieces of legislation. And for some of you, there may be none technically that actually apply, just because FOIP is in general for government bodies. HIA in general is for when you're collecting health services, or if you have healthcare professionals. And PIPA in general is for commercial entities and commercial activities. So some of you may not fall in any of that. But the point I'm trying to make is, some people see that as an opportunity to do whatever the hell they want, right? And what I'd like to say is, learn from the intent of the existing legislation, right, that the forefathers put together. There is a consistent theme in there about how to protect people and what are people's interests and best interests, right? So there are learnings in there to be applied to practices, even if they don't specifically apply. Because the truth is, even though you have no legislation tying your hands necessarily, if something happens and if there is some kind of damage that can be proved, I mean, that's still not a good thing, and it's not a good thing for reputations or anything, right? So, but again, it is important to consider some factors. In terms of the technical capabilities, again, some use large, complicated systems like ETO, share vision, that sort of stuff. Some are much more basic, like on paper, and then data entered into Excel and whatnot. Some use the data in terms of regular reporting, or even in terms of analytics and whatnot. Some really just kind of keep the record of people coming through because they think, we should. Sounds like something they should do. So it's really quite a variation in terms of why people do the things they do in terms of that data management and data collection. And there's a lot of, again, what I talked a little bit about before is around the data harmonization piece. So one of the things I'll get into later on is, and what again, came across as one of the difficulties in analyzing that data across a few organizations, that they were collected just so differently, right? Questions were asked so differently. So I'll get into that a little bit more. And again, it's a matter of priorities. And so for us, it's talking to them about that, this is a worthy priority for an organization, but also in trying to work with funders and saying, this is a worthy priority for them to add to their line items when they do their budgets, right? And which is very much where the research sector has been going for the last 10 years, right? They've gone more stringent and stronger in terms of advising on data management and data sharing, into mandating, into really very much accepting that as part of the package of the budget and activities. So again, some of the benefits to sharing data amongst the nonprofit organizations, I'm not saying necessarily like hundreds of thousands of organizations all dump their data together. It really has to have a purpose. But as you can see, from the Child and Youth Data Lab case, you can get really unprecedented insight into populations that you might share if you were to look at data in a more cohesive, sector-based, cross-organizational format, right? So we'd be able to see sort of who's coming through different doors at different times, repeat rates, and that can speak to outcomes, whether things are working, whether things are not. And that can then speak to where can you improve, where can you collaborate and work together, and integrated service delivery is really a big a priority for the governments and other organizations, right? So the other thing is what I alluded to before about strengths and weaknesses among different organizations, right? So here's again where we're pooling, or not really pooling, but bringing data together can help, because one organization might collect information about income, but another organization doesn't. But this organization, I collect information about food insecurity, but you don't. But I wish I knew about addictions and mental health, which neither of us collect. But hey, that third one does. And then if you were to able to be looking at that data together, even at a geographical level, so not even at a level that would have any concerns with privacy, even if you were to look at it a neighborhood level, that would be an incredible resource. that would help them understand their population better and see how they can work. I think I'll probably breeze through this pretty quickly just because it's just a lot of different data elements. Suffice it to say, we did look at a lot of intake data from the different organizations that were at the table. And again, this is actually just intake data, and there were already like a ton. And so we went through a fairly brief, really loosey-goosey semi-Delphi process. I'm sure they'll insult anybody who's an expert in that sort of stuff, but to really kind of whittle it down to what data elements might make sense. And the reason why we had to do that was because, of course, many of the things were asked very, very differently across those organizations. So just as an example, one organization might ask about, I think they called it suicide concern, right? Another organization, I think, was more specific about suicidal thoughts and ideation or something like that, right? So again, it's along the same thread. So certainly we're interested in the same topic, but when you ask it in such a different manner, we can't just mathematically put that together because that's just not quite valid, right? Because so one of the things that we're hoping to do in the next couple of years is really look at, can we put together some tools, instruments, questions, like a database somewhere, and just draw from. I mean, nothing to be enforced because of course we're just another nonprofit, but that could help people at least draw from the same resource and have some rationale behind why they ask certain questions, right? Because when we do talk to them about this, and they're like, how did you design this question, right? And as any evaluator knows, design of instruments is a big deal, right? It really sets the tone and puts you on a right or wrong foot for any analysis that you might do at the end of the day. And so if they were given that help and that rationale, that support at the head end, it would really help. So again, in terms of the poverty indicator, because we didn't really create a new indicator de novo out of that, just because there was a lot of differences in how questions were asked. But what we were able to do was, we really were able to analyze at least at an individual organization level, and look at what are some of the similarities and the differences between some of the organizations that were at the table. So for example, something like Calgary Counseling Center, even though their population geographical coverage was very much overlapping with, say, CUPS, but their socioeconomic status totally doesn't, right? As you can imagine, it's a more of a vulnerable population accessing services from CUPS and Calgary Food Bank, and more of a spread in terms of the Calgary Counseling Center. So.
Do you guys, is there room for tweaking this yet?
Oh.
Is there room for change and growth?
So this is a proof of concept. So yes, so we're pursuing basically the next set of
Because in Edmonton, the common outcomes sector, we sat at a table many times and came up with the common outcomes and the indicators and all the measurables, so that when we go in to fill them in, we have a drop-down list. And so everybody's using the same words, the same lingo, the same dialogue.
And that's perfect. And that's exactly what you would like to see more from. But that is definitely an exception rather than a classic from what we're seeing. So the next part that we did was actually a data linkage exercise. And so this is using their data, but as a proof of concept. And I won't go into the technical details, nor would I ever do justice to how this is actually done. But this is a methodology that is considered privacy preserving, where individual organizations, in this case the nonprofit organizations, and individual ministries, when we use this type of methodology for Chinese Data Lab, meant that each legal entity did not have to release direct identifiers such as names and addresses and whatnot. And so basically, not that privacy is simply addressed by that, but privacy legislation really applies when data is identifiable. Right? So it's not a way of getting around it, but it's a way to mitigate that risk, right? By using non-identifiable information to conduct linkage. And then the linkage, since you don't have names and addresses, is done through a more complicated, probabilistic manner. And again, definitely get in touch. I can definitely explain that, but I think it'll take me more than three minutes I have left. So, but we were able to look at the overlap. So just like we had looked at the overlap between the government ministry programs, and that was one of the really the novel insights of the Child Youth Data Lab, we tried to do, we basically were able to do the same thing with between 3 of the organizations. I mean, I won't show the numbers, but this proportionally is basically around what it looks like in terms of the overlap between CUPS, Food Bank, and County Counseling Center. And again, this is one of the key pieces of learnings that were not possible without sharing data with each other, right? One of the when we started this project 18 months ago, the Food Bank representative, Dimitri, he mentioned, one of the great needs is to know about referral patterns, right? It's because we keep records of who we refer to, but you don't necessarily know if they go or not, right? Or what happens to them, right? Or if you give them 6 choices, which one do they end up at, right? And this is the kind of information that we're able to gather and tease out if we are able to look at that data in a more sector-based, cross-organizational way. So now, the next big thing for us then is, okay, so we're able to link data in terms of telling who walks through the door. And we've been working with organizations on extracting some of the elements around, say, in that case, it was around social economic status, addictions, and violence, family violence. So again, the next big step for us, again, beyond this proof of concept, would be to try to tie those concepts together, right? Again, through better data harmonization and whatnot, to look at populations of how they flow through, what are their experiences, and starting to tell some organizations that may not have that information about some of the demographic or some of the life circumstances of people walking through your door. Again, not really at the individual level, but at the population level, right? How can you help these people better? How can you connect with other organizations better? So one of the big lessons is really around making sure that these issues are thought about and discussed ahead of time, right? In terms of, again, going back to the idea of garbage in, garbage out, if you don't have good rationale for what you collect and how you collect, it's often very difficult to reason after. One of the key things I want to bring up is that, again, there's that knee-jerk reaction of I'm not sure what I can do, so I would do nothing, right? And so it's really important to look at the balance of that protection of the individual and the benefit of society, which is really contemplated within the legislation, again, by our forefathers and whatnot. So for example, within the health legislation, the Health Information Act, that is contemplated, right? So there are certain leeways given to custodians, especially sort of the government and Alberta Health, to do many things with the data without individual consent. Because I mean, so like I said, we have Child Youth Data Lab data that has over 2 million people. I would imagine a few of you are in the room today, and you probably didn't sign the darn thing. But again, that is within the research and evaluation aspects of the legislation. And of course, we can't really tell who you are. So where do we go from here? Again, building trust, we'll continue to build those relationships, through AFN IGC with communities, directly through nonprofit organizations, with funders, to really look at this as an asset, data as an asset, to look at the collaboration as a key to success. Capacity building is a really big thing for us in the next little while. So in fact, in a few weeks, we're going to have a 3-day training session for the AFN IGC. Again, starting from how does Excel work to how do you tell a story with this particular graph. So that'll be a key for us as well. We really want to look at that sector-based perspective, and I would also say that client-centered perspective, right? So rather than just say focusing on mentorship and your mentorship colleagues and your mentorship networks, but really to look at that youth and what else might they need in their life and how best to connect that. And again, not to say that you guys don't, because again, I realize that organizations do mentorship, but other things as well. But to, again, look at that in a more sector-based, cross-organizational manner. And again, some of that is done through data linkage and data harmonization and sort of some of the pre-thinking that needs to go in. And again, so what I'll leave you with is really the value of data is in its use, right? So There's no point collecting it if you're not going to use it. And if you're going to collect it, you might as well use it to its full extent and get as much bang for your buck. Because honestly, you have more things to worry about than just collecting data. So here's the email. Again, please get in touch. So I have to go back for a meeting, but I think Robin is going to hang around for a little bit more. So again, I really invite everybody to get in touch with us. Right? We can just chat about what we've done, what you've done, get a better understanding of the sector and the organizations, and go from there.
You have 5 minutes. You could take a couple questions.
Karen?
Just in the Calgary Thrives example, and the agencies that are involved, were you able to show that overlap? What benefits are they seeing about moving forward? This was a proof of concept. Can we do it? What they tell us? What are they telling you about, okay, this would be useful for us to begin to tell these stories?
Yeah. So it's still early because we just showed them, and so that's why we show it. The other thing is there were some flaws in the initial instruction, so we actually had to develop it. So again, as a proof of concept, I think it's right now at the stage in their heads where that's interesting. I didn't know that. But I think where it becomes actionable is having slightly different partners at the table, right? And that's why we really need to look at that concept. Again, this was coalition of the willing of 22 organizations. They don't necessarily always have a lot of service overlap anyways. So again, as a proof of concept, it worked beautifully. But in terms of something that would impact their immediate actions, policies, practice, I think we have to involve more partners, to be honest. Right? It was just a couple, 2 or 3 linking data, that's just not enough.
Maybe a question for the room. So when you hear this, and you hear about the compilations, and then you hear about the data that they're collecting, what do you think about, and how would this be useful to you? What would you want to tell Jason?
Just a little comment. So we have been collaborating with Ralph Shields, and we've got a tablet system now. We've tried everything over the years with our kids, from fingerprint sign-in to sheets, manual sheets. I've been around for a long time with this organization, and we used to get Noah and Jesus and all kinds of people signing in, and then we've developed a number of attempts over the years to track our kids so that funders, when they ask, we can approve. But so we've recently, just within the last month, started this, put into place, it's been about 18 months in process, a tablet with data and names and what have you. One of our staff had a real problem, was really freaked out by the fact that this data was going somewhere in the cyber world and that kids could be identified, especially our at-risk kids. But one of the very first things that happened was when we took the tablet out, 2 of our youth said, oh, you're going to be just like this group now, or oh, now you're going to really label us or try and do whatever. And so we had made it really clear to our kids that this is optional. You absolutely do not have to participate in this. Now we as staff, Eva and Dan have the opportunity to just manually sign kids in by first name if we need to. We've got over 100 kids in the data. We have 283 kids that we're actively serving. We have 100 kids in the tablet. So we can put them in, we can track them when we have time, because obviously we're busy mentoring. It's very difficult to sit on a tablet. But there's 2 things. You worry about where that data is going and how to protect the kids' privacy. And 2, kids don't like to be identified.
Yeah.
So they come to us because we're not children's services. They come to us and they share it, disclose to us, even though they know that we're related to children's services and we may have to do children's services work with them. But there's this trust and relationship there, and they don't like to be identified. And just back to the comment about the food bank participating in Calgary. So we have over the years, we are a food bank people, but we have very hungry families that refuse to register for a food bank number because they don't want to be identified by a system because of fear that someone will come and take it this way because they can't feed them. So it's all just part of that whole data thing and privacy and personalized and all that. So just some comments.
So absolutely, and that's very true. So again, it has to be clients first, right? And so if it is a context where they don't want anybody to know, or even you to know who they are, well, obviously, we can't do this sort of stuff, right? And that's fine. I mean, there are certain limits within that service. I mean, we're not going to argue with that at all. But I mean, what I would say is, again, that dichotomy between primary collected data for, say, survey or evaluation versus administrative data. So there could be societal level questions that you could answer with then administrative data, which is collected, from everybody, whenever you track the system anyways, right? So again, it won't be so specific. But again, I mean, you do what you can within the context of your service. So yeah, absolutely, we definitely would not argue with that.
I would say the other piece that would be really interesting here is we heard funders, but also in terms of program design and really knowing our communities and knowing we can get access to more data about where they're at and where the community's at and who are our future proteges, mentees, who's coming up the pipe too. So that's really interesting.
So you've been waiting.
Your slide about the linkages between the organizations, the linkages we made obviously between the
So it is. So it's actually based on identification. So
Oh, it is,
what
right.
happens? Again, now this is the technical detail, but very quickly, we have we build a certain it's called an envelope builder. It's sent to each organization. It runs a certain algorithm that hashes all of the identifying information in a one-way manner so that it cannot be back computed. Linkage and the algorithm also even so like a John Smith and a Jonathan Smith will spit out a different hash, but the algorithm can deal with that and figure out it's probably the same guy. So again, so that's how it does
that
it.
was your head.
And it can find
Exactly.
cross services, it can find that same person.
But again, analysis is always done population level, and that linkage is not 100%, right? Because again, even if you had John Smith and John Smith, unless you brought them together and sat them down, you don't actually know they're the same person, right? So it's all probabilities.
And John Smith may give you different replies
Exactly.
to
Yeah.
every different agency.
Yeah, absolutely.
I really want to honor Jason's commitment that he has to go, but thank you all.
Thank you very much.
If we email data policy-wise, will we reach you?
Yeah, person on our team anyways, they'll be just diverted to whoever needs to see it. And please do go ahead and share the slides.
Please, we will we'll set that out as well. So thank you very much for again your time. Very thought provoking, and my head's just spinning about potential here. Also for the folks, there's a lot of people in the room who are from different provinces. Are they able to get this as well?
No,
too?
actually, one of the things is that we want to work with different governments and different provinces, again, to apply some of our learnings. Because, again, we've now built the software to do this sort of stuff, so might as well use it. So.
Excellent. Yeah. Well, thank you again.
Thank you.